Okay, Charlotte, you finished your objective examination. What have you found to be the main problems?
Probably just his shortness of breath seems to be a bit of an issue. So we did have problems with that before, but it seemed to got worse on his stay.
Do you know if can you tell if that's worse now than before?
I think it's gradually getting better, but I think it's still a problem for him because he said he'd get quite short of breath on hot days, he said, when he was bowling. But now in the gym, he's sort of settling down a bit and it's improved, but it's still a bit of an issue for him. I think also just general sort of strength and independence with his walking and stuff. I think it's just a bit of a confidence
Is he independent with his walking?
Yeah, but just longer distances and that sort of stuff.
So independence or something else maybe?
Probably just his tolerance of his walking and yeah.
Good. Any other main problems?
Well, his sputum production seems to be alright. He reported that he barely coughs anything up anymore, and he hasn't been coughing a lot, which is good. So he generally feels quite well. It's just getting his endurance back.
How would you describe his cough?
It was moist, not productive, effective. So it was alright, but nothing came up.
Yep. Good. Any other problems?
He had no reports of pain or any other sort of symptoms. His shortness of breath seemed to be quite okay.
What do you think is contributing to the shortness of breath?
He had crackles on auscultation in his right lower lobe, so he probably still has some problems there with his ventilation. But he does have emphysema, so I think it will be. He said that he's discussed with his doctor, and it's going to be something that he will have to deal with.
So were there crackles in both sides, or
no? It was just his left side.
His left side,
yeah,
or his right side?
I think I said right to start with, but it was his left.
Left side.
Yeah.
Okay. And where was the pneumonia? Do you remember what lobe that was in?
Yeah, I think it was the left lower lobe, and he had some problems up in his right upper lobe as well. But there was no sound. It was normal air flow through there.
In the right upper
yeah.
lobe. Okay. What did you think about his breathing mechanics?
He was often quite braced, with his hands on his knees, and quite shallow upper chest breather. Yep. But then when he sort of relaxed his hands, he could breathe without bracing himself. So whether it's just a habit thing now that he holds on, but his bibasal expansion was quite good. Yeah.
Were there any other objective signs that were abnormal?
Didn't he do like facial sort of accessory sort of things?
Anything else you picked up?
Just that when he was braced, he was quite tense up here, and you could see he was using a bit of accessory muscles. But then if he relaxed a bit.
And what about his posture? Did you look at his posture?
He was. Do you mean like musculoskeletally or just he was sort of a little bit kyphosed, but
quite kyphotic.
Generally, like he had quite good sitting balance and all that sort of stuff.
Do you think that might affect his breathing, his kyphosis?
Yeah, probably. Yeah. So he could do some, thoracic mobility exercises.
Good. That would be a good idea. Excellent. Any other problems that you came up with?
No.
No?
Did I miss anything?
Just I guess maybe looking more at the posture and mechanics of breathing, but that was pretty good. What about when you looked at his bibasal expansion? Maybe you could have done that with his shirt off. Would have been just so you could have actually sort of looked a bit better. But that you still did it. And I think just with the 6-minute walk, just making sure you ask his perceived exertion at rest before you start, and then asking that at the end as well. Yeah. As well as taking the SATs. Do you have a treatment plan that you think would help to address his problems?
Well, I think the 6-minute walk could be sort of included as a treatment because it's a fair sort of walk for
Good.
him. He said he had some breathing exercises, so I might have a look at,
Yep.
at how he's performing those.
Yeah.
And maybe have a chat to him about when he gets home,
Yeah.
the sort of walking that he can have a think about, and
Good.
sort of getting
Good.
back up to how he was before.
Yeah. So, what would you think would be the most appropriate type of treatment for him as far as breathing exercises?
As far as breathing exercises?
Oh, yeah.
Well, I think for him, maybe mobilisation would be
Yep.
probably one of the first things you'd want to do,
Good.
just because he has been in hospital for a bit,
Yep.
so it will improve his strength and his endurance, and then it also helps to clear secretions as
Yep.
well.
Excellent.
So maybe have a go at some breathing exercises when we come back from
Yep.
the walk.
Do you think that you need to do breathing exercises on top of the walking to help clear secretions, or do you think that the walking is enough?
The walking could be enough, but I'd like to have a look at the sort of exercises that he has been doing,
Yep.
and see if he's got any techniques to decrease his breathlessness or
Yep.
anything
So,
like that.
can you think if there's any evidence that might support one treatment over another for someone with his problems?
I think generally mobilisation is sort
Yep.
of the best way to go,
Yep.
but sort of in combination with some breathing exercises could be effective for different patients.
What type of breathing exercises do you want to teach him?
Probably some deep breathing and maybe an SMI,
Yep.
and then some coughing to see if there's anything on his chest.
So, what's your rationale for choosing those ones?
So deep breathing to open up the alveoli, and
Yep.
then an SMI to sort of open up the collateral channels, so we can get the air in there and get it behind the sputum if there's anything sitting on his chest. And maybe some relaxed breathing too if he gets short of breath.
Yeah, so that's a really good idea. He's going home soon, so teaching him some positions for shortness of
Yep.
breath. Yeah, that would be a good idea.
Yep.
Yeah, all right. Well, we'll see how we go with the treatment.
Okay.